This conference will now be recorded.
Hi, everybody. I'm Emily Flynn, the Director of Health and Wellness, and tonight it is December 16th and just before a big snowstorm. I have a few things to read about good practices for video calls, so let me do that, and then I'll talk about the agenda and do a round of introductions. So let me get going by saying that tonight you're at the Live Well Kingston Commission meeting, and I already said who I am, but I'm Emily Flynn, the Director of Health and Wellness. And it's good practice to mute yourself if you're not speaking to avoid background noise. As the organizer, I observe the right to mute anyone. Please state your name clearly for our audio listeners. I don't see any at this time, but if any join, if you don't mind trying to do that. It's hard to remember sometimes. Both video and written transcripts will be made available to the public on the city's website at a later date. Let's see, I reserve the right to lock and pause the meeting and to eject anyone who has behaved inappropriately. And those are my kind of introductory notes. And I'll call this meeting to order at 4:05. And let's do a quick round of introductions, just because we have some new faces with us today. And then I'll go through the agenda. So next, in the next block, I see Katie. Katie, do you mind introducing yourself, and then can you pass it to another person?
Sure. So, hi, my name is Katie Sheehan Lopez. I'm the SNAP-Ed nutrition educator for Ulster County at Cornell Cooperative Extension, and I'm also the chair of the Eat Well focus team. And I will send it to Jerry.
Hi, I'm Jerry Harrington. I'm the marketing coordinator of Health Alliance Hospital, and I'll pass it to Heidi.
Hi, I'm Heidi. I'm the CEO of the YMCA in Kingston. I'm also a member of the Play Well Commission for Kingston, City of Kingston. And I'll pass it on to Malia. She's down there.
Malia Dumont, I'm Chief of Staff and Vice President for Strategy and Policy at Bard College. I will pass it to Stephen.
Good evening, everybody. I'm Steve Casa. I'm the Workplace Learning Coordinator at Ulster BOCES, and I'm glad to be here.
May I pass for you? Troy Ellen, would you like to introduce yourself?
Sure. Troy Ellen Dixon, Marketing and Program Director at A.J. Williams Myers African Roots Center. And I will pass it to Siobhan.
Hi everyone, my name is Siobhan DuPont and I'm the Outreach Coordinator for the Kingston Food Co-op, and I'm new here. It's nice to meet you all and see some familiar faces.
May I pass for you, Siobhan? Stacy, I don't think you've introduced yourself yet.
Hi there, Stacy Kraft with the Ulster County Department of Health and Mental Health. And I will pass it to caller 01.
Hi, this is Walter Woodley. I'm from the Institute for Family Health, and I am on a call without video, so I don't know who to pass it on to.
Thank you, Dr. Woodley. I think you're the last one for now. Thanks for calling in.
Okay, thanks.
All right. So on the agenda, I had first some approval of minutes and then some administrative matters. I have also on the agenda an Eat Well presentation, and Katie is here, and I think it's fair to say Katie has to go make dinner for her family at 4:30. May I switch up the agenda? I'm going to have the report, and we'll try to go through it quickly, and then we'll move on to administrative matters if everyone's okay with that. Thanks. All right. And I want to also just say, I think that we'll have a sort of fast meeting tonight. Fingers crossed. I don't think the agenda is totally packed. So I hope to try to get us out here early tonight. All right. So let's go on to this Eat Well report. Katie is the chair of Eat Well, and we've both been deeply involved, as long as also with Troy Ellen, who's now a commissioner, with the Kingston Emergency Food Collaborative. And my hope was to do a little bit of an update. We did an Eat Well report, I think it was more than 6 months ago now. And I wanted to kind of come back to it because there's still a lot of active work that's happening there. And I can talk through the report, or Katie, do you want to talk about it first? What would you like?
Sure, I can just give a quick update. I'd really put together from the last quarter. I don't remember when the last time I presented, but yeah, could very well have been 6 months ago. So in the last quarter, so October, November, December, we've had 2 Eat Well Kingston meetings. So our typical schedule is every other month. About 12 people, give or take, have been attending every time. And in the most recent one, at the beginning of this month, we had a presentation from Jared Williams from Future Fruit. And so for 2021, this is the plan moving forward, to stick with the this every other month schedule. And we're going to have a presentation from a different community agency every month. And those have pretty much been scheduled for the year, which is great. And I'll be sending out emails for presentations that I think would be, of interest to a wider audience. So couple project updates. Kingston Emergency Food Collaborative, for those of you that don't participate in those meetings, kind of came out of this Eat Well Kingston back in March, and would continue to meet very regularly, which is why I see Troy, Ellen, and Emily all the time. And there's a little bit of detail in the report here about number of meals that are going out, number of groceries, how many families, etc. Suffice to say, there is a lot of discussion about how we're, meeting needs that exist right now, and potentially very short term, as as cases numbers continue to rise, but also discussion about kind of longer term what food access looks like in the city of Kingston, and how we can address it, not solve it necessarily, but work towards addressing it. Also, one of the most recent Eat Well Kingston meetings, it was kind of brought up that maybe there's some promotion of local ag that could happen, as was renewed interest in farmers markets back in the spring. And we had a couple of meetings that kind of spun off into its own group. And we met twice, and Matt Igo from Roundout Valley Growers Association has now taken over facilitation of that particular subgroup. And that's kind of moving forward over the winter, discussing how to best promote local ag, getting some input from stakeholders. So that's kind of happening, but like out of the purview of Eat Well Kingston these days. So I think, let's see, what else did I have that was noteworthy? I think that's kind of it for the last couple of months. If anyone is not on the email list for Eat Well Kingston but wants to be, can let me know. And it would be great to see you at a meeting in February. Thanks.
And I have a little bit more in this report that I can talk to. So, well, Dr. Woodley, you won't be able to see it on your phone, but I can email it to you after the meeting. But what I did in this report was take some of our goals from our action plan and try to answer where we went with them. And I'm not going to go into much detail, but I will say at the high level that we pivoted a lot to support the Kingston Emergency Food Collaborative. So many of our goals kind of got pushed to the side, but a lot of work has been happening with the Kingston Emergency Food Collaborative. And I want to mention that I think at our previous presentation, we mentioned that we were up to at 1.3 thousand meals a day, and there still was grocery delivery going on, which is still happening. And the Kingston Emergency Food Collaborative is hoping to really flesh out a full report on that. I don't have that at this time, but when that's done, I'll bring that to this group. In the meantime, we're still continuing to do about 100 meals a day out of the Everett Hodge and around 80 grocery deliveries weekly to 2 different, an A and B group every other week. And as Katie mentioned, we're working, we have subcommittees in education, coalition and capacity building, systems change, and more. So there's a lot of work that's happening there. Also in this report, I wanted to mention a lot of work that's been happening between farm to school support. So out of an Eat Well meeting, and I looked back at the dates, Katie, it was back in January, I think, was our first farm to school working group meeting. That came out of an Eat Well presentation the year before, you know, I think in December, this time of year, the year before. And we have met, I think, about 6 times this year. So even for a difficult year, it was pretty impressive that there was a lot of conversation around trying to support farm to school work and how to connect agriculture into our school system. And one of the great projects that came out of that group was the Farm Hub did a spend analysis with the school district. So they're trying to review all of the way that they spend their money and their receipts and try to, there's some, Katie can correct me if I'm wrong, but there's some state programs that if you can spend 30% of your money with local funding, there's some added benefits. So that was part of the goal of some of that spend analysis. So those were kind of the highlights. You know, the things we didn't really get done is we had robust goals to try to create, get the members to send in blog posts and send that out, and that stuff really didn't happen. But I think we have the goal of doing our next action plan early in the year. And I think we'll review what we've done here and really have that help inform what our goals and priorities will be in the next year. So that was kind of a lot. Katie, any corrections from me? Troy Ellen, you want to add anything that I missed on the food collaborative or any questions that anybody's got? Malia, you got your hand up?
Yeah, first of all, I just want to recognize again the tremendous work. It's I've been a supporter of the Kingston Emergency Food Collaborative. Lately, I've seen I follow the Kingston, the Mutual Aid Network. I forget exactly what it's called on Facebook, and I've noticed that it seems like a lot of the neediest members of our community are then being taken by social services or whatever the government agency is, and they're being placed in hotels or motels that are not in Kingston. And so then, like, they were already having difficulty accessing food when they were here in the community, and then they're moved to Catskill or Kerhonkson or Ellenville or someplace that's not even close to people they know, and they're asking for people to come bring them food to these remote, relatively remote locations. And maybe this is something to talk about in early January in the action plan, but I'm just really concerned about those communities who are already having difficulty, and now it's like they're even more, I mean, at least they're housed, but it puts them farther away from the food they need. And so I assume that's been part of the discussion, but I'd love to be part of that discussion myself and see what people think about that.
Well, Malia, you're welcome to join. We have we have conversations about this in coalition and capacity building meeting that we just wrapped today, as a matter of fact, and spent a lot of time developing plans going forward. But let me interrupt myself and point out, we are trying to work with Kingston Mutual Aid, KMA, so that we can support people who are outside of the city of Kingston boundaries, outside of the Kingston City School District boundaries. For example, today we came to the decision that we don't care if they're in Catskill, Saugerties, Kerhonkson, Ellenville. If they are a Kingston City School District family, we want to support them. We just need to figure out the best way to do that. Planning for January, February, March is going to support people in a more meaningful way, as opposed to someone ordering pizza because a family is hungry, and in a more sustained way. We're also working with food partners, Catholic Charities, which has a truck and goes to those communities. We're working with them to be able to provide not only just prepared meals, but low prep meals also, because many of the people, they have a mini fridge and, you know, a microwave. So it's not like they can take groceries and cook them. So it's all part of the conversation that we're having, and trying to make sure that, you know, while we're working on systems change, I think there's a conversation being held at members of our team being held at the county level about people who live in boarding houses, for example. They're supposed to be provided 3 meals a day, but we are delivering meals to people in boarding houses. So we need to figure that out. And, it goes on and on. But as I said, we have a 2 o'clock standing meeting every Wednesday. Not sure what your schedule is, but I know Katie kind of manages the calendar and would be happy to include you in the conversations. You also could be involved in direct service, education, Katie's education, I'm direct service, systems change, that's Emily, or food production and procurement, which is someone not on this call.
And I don't know if you said it quite this way, Troy, but also in the group that's working on systems change, we're looking at trying to find how the DSS system works and try to see how we can create bigger systems change around, some of the people who are placed don't have a kitchen, and how do we kind of ask DSS to place them in better facilities. Some of those kinds of conversations are happening. Any other questions around this Eat Well report? Any other thoughts?
Well, thanks for adjusting your agenda for me. I have a 2 and a 4-year-old in there. Do not understand, like, mommy has a meeting. So I'm gonna go feed them. Thank you all, and we'll see you all soon.
Thanks, Katie. All right. We'll jump back to our regular program. So I had approval of minutes next, and then administrative matters. So since we have a quorum, why don't we go to the approval of minutes? The last meeting minutes were November's, and if anyone is interested in making a motion to approve those minutes, I could hear that now.
I make a motion to approve the minutes.
I'll second that.
Thank you, Jerry. All right, then I'll say all commissioners that are in favor of the November minutes, say aye.
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 All opposed? Any abstentions? All right, hearing none, the notes pass. Thank you so much. That was an easy one. So next comes to administrative matters, and I'm very pleased to see we have some guests here tonight. I don't see Susanna or Freddie, but we've had 2 applications. I think we've talked a little bit about Susanna Callahan. She works for the Institute for Family Health, and she has submitted an application. And Fredimir Garcia works for the Health Alliance of the Hudson Valley. He's also submitted an application. Also with us tonight is Siobhan. She has submitted an application. And as we usually do for commission, we invite those people that have applied to come and introduce themselves. And then I've been talking to Steve, and I'm trying to see if Steve and Heidi are also interested in being a commissioner. So they're also here if they would like to introduce themselves to the commission. You're more than welcome. So why don't we start with Siobhan, since you've submitted an application. Would you like to introduce yourself to the commission and let us know any questions, and the commissioners can ask you any questions if they have any.
Sure, I'm happy to start. Hi, everyone. My name is Siobhan DuPont. I mentioned this before, but I'm the outreach coordinator for the Kingston Food Co-op. For those of you who might not know about it, it's a community-owned grocery store coming to 708 Broadway in the old Honda building in Midtown Kingston.
I can't hear very well. Sounds like there's a problem, at least to me.
Yeah, I'm hearing a lot of feedback.
Is it better? Is this better? No?
I can hear you. It's a little broken up. I
don't have any headphones. Otherwise, I would plug them in.
It's okay. Go ahead.
Okay. I'll try my best. Sorry about that. Bring headphones next time. But Yeah, so I work for the Kingston Food Co-op, community-owned grocery store coming to Midtown Kingston. I used to work at the YMCA Farm Project. So that's how I know Heidi. Hi, Heidi. And I lived in Midtown Kingston since I was 5. I'm 23, so this is my home, and I'm really excited for the opportunity to be a commissioner for the Borough of Kingston.
Thank you so much, Siobhan. Commissioners, do you have any questions or anything you'd like to say to Siobhan?
Well, this is Jerry. Just curious, do you feel there's a particular strength that, I mean, you talked about what you've done, which is great, but do you think that there's like a particular thing that you would bring besides just your general background to the commission?
Good question. Yes, I do. I think that I bring the perspective as a young woman of color who grew up in Kingston, and I can share my experience and just my insight on what that's like. And I think, I mean, I'm excited to share my vision for Kingston and what I hope our community will grow into. So,
Yeah, thank you very much.
thank you, Jerry.
Any other thoughts or questions? I want to recognize that Anna has joined us. Anna's another commissioner. Hi, Anna. All right, well, why don't we move on to another introduction, and then we'll see how it goes. Steve, how about you? Would you like to introduce yourself?
Sure. Thank you, Emily. My name is Steve Casa, as I said before. I'm the Workplace Learning Coordinator with Ulster BOCES. I've lived in the Hudson Valley since 1994 in Orange County first, moved to New Paltz in 2005, and I now live in Woodstock. I've been with Ulster BOCES for 3 years, starting in February. Prior to that, I worked nationally with an organization called the National Academy Foundation. And my work has been school reform, innovative programming in schools since 1990. I'm somebody who believes strongly that our American education system in no way, shape, or form serves all kids, okay? It serves certain kids. My real work is in high schools. I believe high schools do an incredible job preparing kids, or are set up to do a great job preparing kids for 4 years of their lives. My whole thing is about what about the other 50 that they're going to have to work. So at Ulster BOCES, we focus very much on trying to make sure that our young people are college and career, truly college and career ready to make choices. I sit on the board of the Hudson Valley Foundation for Youth Health. And youth health is an extremely important thing to me. We give grants to a number of nonprofits in the area and a number of counties. And like I said, youth health is a very, very important thing to me. My daughter was very ill for a few years, and it literally changed everyone's life in my family. She's doing great now. But I remember being like somebody that was always just completely clueless as to what was going to be next, because nothing was in our control. And I'm also somebody that believes very strongly in preventive health and making sure that we're exposing more people to the right kinds of opportunities for health. When I was speaking with Emily, one of the things that I know from my life in Brooklyn and working in a school district, that had a high, impoverished population, really centered around the lack of choices for these young people, for these families, right? And then, of course, that just trickles down to young people. So I'm very interested in participating. I'm here today to learn a little bit more, and then I'll make a decision on whether I want to put an application in. But again, I think that it's great work, and very, very excited about what's happening in Kingston and how it's actually affecting the rest of the area, the county, the cities, villages, et cetera, around it. So that's me.
Since Steve is still deciding whether or not he wants to apply, we can ask questions of him, but I also don't want to grill him because he hasn't even applied yet. But do any commissioners want to ask any questions?
Listen, I grew up with a Sicilian father. I was grilled every single minute of my life, so it's nothing. As a matter of fact, I'm more comfortable being grilled than just like sitting here talking. So.
Oh, this is Jerry, not to grill you, but we have certain like subcommittees we have that have certain focuses, and you spoke about education and health. Do you see yourself in particular, like giving strength to one particular of these subcommittees?
Yeah, sure. I mean, look, my strength is really going to be centered around the fact that I work for BOCES. We engage with, 8 school districts around the county. We have an incredible culinary program. We have a number of different programs that I actually see a number of potential linkages. Interestingly, I think if I'm not mistaken, I have the same job that Emily's dad had at BOCES a number of years ago. So, we're trying to do good work to try to make connections. And I think that's the other strength that I bring to the table is, my whole role is really centered around creating connections. And I believe that, with respect to if this does come to fruition, anything that's going to be related to how to engaging young people, right? Jerry, one thing that I really believe in is that I believe that habits get created when you're young, obviously, right? And good eating habits, good health habits happen then too. So if you're exposed to unhealthy stuff, you're going to be unhealthy. It's that simple. Look, guys, I'm Italian. I've eaten macaroni all my life, and then all of a sudden I found that I have high blood sugar, so I can't anymore. So maybe if I ate a little less macaroni, but hopefully, if I do come on board, I'll be able to help along the lines of exposing more young people and getting more young people engaged in the work.
Excellent. Thanks very much.
All right. How about you, Heidi? Would you like to introduce yourself?
Sure.
Yeah.
Thanks. Hi, I'm Heidi Kirshner with the YMCA. I've been with the YMCA for 10 years. I came from corporate America, Alcoa, actually. I was their director of distribution for the Americas, North America, South America, Canada. And having kids, I decided it was be time to maybe stick around home a little bit. I was traveling almost every week, and I had been on the board of the Y. I really like the organization. I like what it does. And so I decided to apply for the position that had just opened, and I got it. And then it was like, oh, damn, I got this. So now I had to, it's been a journey. I know historically the Y has always been recognized as a place where you go and you work out, where you swim. And several years ago, we conducted several community events and surveys, and it was clear that the expectations or the desires for the Y were a little bit more broad than just being a place to go and swim. And so we've made the conscious decision and are slowly moving in the direction of making the Y more open to more activities that are educational and enrichment for our community. We have had, part of the Y has always been childcare in several schools throughout Ulster County. I think we're in 9 at this point in time, prior to COVID. And we do have an urban farm in our back lot that's very active and doing great things. We have 4 camp programs that we operate right now, so those are great things. But we're also kind of getting more involved in activities that bring our community together, and then activities that work on, creating, I guess, a healthier environment for youth and adults. And when we talk about health, not only is that you talk about physical, but there's brain health, there's mental health, and there's just, all well-being of the individual. So, when Emily asked me about this, time is really tight. I've got a couple of construction endeavors going on right now, and some other things that I'm building, but you know, this is the work on this committee is really good. It touches so many aspects of Ulster County and Kingston. And so I just wanted to listen in and see, you know, what's involved. I mean, you know, from the fundamentals of having a roof over your head, that's important, to being able to eat, having access to healthy food so that you can, you know, live a good life. That's important. And then being able to just do things in our community. And that's basically what the Play Well Commission does, and that we've worked on. This year it's been kind of tough. We've kind of stalled out a little bit because of COVID and having to, you know, keep, you know, things separate and distant. But, you know, it embodies a lot of things. And, you know, when you look at a community, those are the things that people think are important when anyone's considering moving to Kingston or relocating a business to Kingston. Those are things that are important to them. You know, what is the access to this? What are, you know, what can we do? And so this commission touches a lot of it, and you know, it helps a lot of people, and it also, you know, it's just good for Kingston as well. So those are things that made me interested in being part of this. So haven't decided yet.
Any questions for Heidi?
It's got to be one.
How about the status of the pool? The pool is open now?
Pool is open, and I couldn't be more delighted. It's a lovely pool. It's getting its use. It's busy from every moment of the day it's open until when we closed. So it's great. Yay. All right. Thank you.
All right. So I'm going to propose to the commission that after we get through our business, that we go into executive decision to decide about the applicants that we've received. And at this point, we'll, you know, thank Steve and Heidi for applying. And I really hope that you do join us. And thanks for coming tonight to take that step to find out what it's like. Really appreciate it.
Definitely grateful to be a part of it and to see what it's all about. Thank you.
Yeah. Thanks so much again. Do you want us to now sign off?
We have a little more public business. You're welcome to stay to the end of it, or you can jump off, go, feel free right ahead, whatever works best for you.
We'll just you want us off when you go into executive session.
I'll let you know when we're going to go into executive session.
Perfect.
Thanks.
Thank you.
Thank you, guys.
Yeah. All right. Thank you guys for coming. So I don't have a whole lot more on the agenda. I had a few updates mostly. I wanted to bring to your attention that we got responses from the inpatient mental health letter that we sent to the state. Didn't have a goal in mind, just wanted to draw attention to that we did get answers, and I really thought that was great that they did get back to us. So why don't I pause there, and does anyone have any parts of that they'd like to discuss? Did anybody get a chance to look at those responses? I could read them if someone didn't.
I don't recall seeing the letters. Can you include them in as a link or something, or do you not have them that way?
I can put them in the chat right now.
Okay, thanks.
So we got a response back from, let's see, this is from the Bureau of Inspection and Certification. And I believe that they were the ones that were saying that, let's see, that the application process for the behavioral health services to move hasn't happened yet. And then maybe I should take a step back. Does anyone need me to recap what I'm talking about here? Okay, everyone, I'm getting some good head nods. Okay, so one of the letters, I'm forgetting which one, said that they have not actually gotten an application from Health Alliance yet about the removal being permanent. And so that, but they were welcoming us to give input when that time, if that time does come.
If I may interrupt, just to be clear, it would not come from Health Alliance. It would come from Westchester Medical Center, from WMC Health.
Thank you for that clarification.
Sorry.
All good. And then the second letter, I read it as that the OASIS, the state, and OASIS stands for, let's see if I can find it quickly, Office of Mental Health and New York State Department of Health. They are also concerned, and I think that they just recognized, they said, thank you for your letter. We are also concerned about this. That's all I got. Yeah.
Sorry, I feel like I'm missing something somehow. So basically, the inpatient unit, hasn't it already closed, or it's not currently available, right? And so they're saying, the Bureau of Inspection Certification saying, well, we haven't received an application for it to be closed, so there's not much we can do about it. But isn't it a problem that they closed it without submitting an application? This seems like a very bureaucratic response to me, and it doesn't really address the reality that we're concerned about, which is this service doesn't exist anymore.
I think it was closed. My understanding is it was closed to provide ICU beds, correct? For COVID. And Jerry probably has way more detail about that. But it was supposed to, the understanding was it would come back. Jerry?
Right, it was closed and moved. The inpatient drug addiction and mental health services were closed and moved to Mid-Hudson Regional Hospital in Poughkeepsie, following Governor Cuomo's request that Health Alliance make a certain number of beds available for overflow from COVID from New York City. This was back in like March or April. And it was presented as a temporary move in response to the governor. And that has been the official answer. What the letter back from the state appears to say is there has been talk that WMC Health, that Westchester Medical Center, has actually asked to make this move permanent. And that's the response that they say hasn't, that's the request they say hasn't happened yet.
Malia, did that answer your question? Any further
Yeah,
questions?
it does. I'm not familiar with how the state bureaucracy works on these kind of things, but I wonder, like, if they do go ahead and submit an application to close, is it mainly, is it like a rubber stamp process, or is there like an actual discussion around whether that kind of application would be approved or not? Because depending on the answer to that question, it seems like we should either kind of gear up to influence the discussion if there's going to be one around an application, or if the application is more of like a foregone conclusion, like what the end result is going to be, then we should try to postpone that application being submitted until we have further discussions as a community. So I don't know what the best avenue for us to influence the next step is.
I'm not sure the answers to that. There are other people that are working on this as well. The nurses union, NISNA, I think it is. They are actually doing like a rally this Saturday. They're doing like a car ride that's going to end in the town of Ulster to kind of get awareness around this. And I'll send out an email with the details to that because I don't have it right at my fingertips right now. But as to the process, I don't know, but I can try to ask. Maybe that's the next step, is try to find out if they were to apply for it to be permanent, how we would find out about it, for example.
Well, from looking at the letter, it says that that they take a very deliberate approach to any submitted application, and that that the City of Kingston can formally submit comments relative to any application received by OMH, and will have an opportunity to speak before the Behavioral Health Services Advisory Council if such an application is presented. So they don't say how we'll know, but they don't seem to indicate that this is simply a rubber stamp. Maybe it ultimately is, I don't know, but they're saying that there is an opportunity for people to comment.
So why don't I reach back out and find out how we can find out if that, when that, if that and when it does happen. Any other discussion around that? All right, thank you for that. I wanted to just, at the last month, we identified a couple of different tasks to do, and I haven't had a chance to do them. And that was to work on our action plan for next year and bring a few people together to work on our action plan, and then also to work on communications. Troy Ellen offered to support me a little bit around the website and some discussions about reviewing that. So that work did not get to this month, so I'm putting it on. I'm going to continue that work in the new year. So I just wanted to update you all on that. And then that brings me to new business, and then announcements and communications. Does anyone have any new business or any communications from their agencies or from their community that they would like to bring to this commission? Stacy's usually got a couple. Or Dr. Woodley, are you talking?
Yeah, I would just like to bring up the fact that it's something that you all know, that COVID vaccines are going to be out within weeks. One of the potential challenges is going to be the fact that there are some people out there who are going to say, no, I don't want this vaccine. And if, as we are thinking about live well and community health and prevention at a time like this, just getting the majority of our citizens vaccinated is going to be very important. And I think that if everyone in this group could have their antenna up and be agents for encouraging people who are reluctant to be vaccinated or who need more information on it, whichever one. If you cannot speak to the benefit of the vaccine, to its safety or anything, if you could get those persons in touch with me, there's going to be a group of us who are going to be willing to just engage with people and go through the pros and the cons. Ultimately, the decision to get vaccinated or not is going to be up to that person. But as we speak about community health, the best weapon that we have now is actually 2 vaccines that are very safe. So I'm just putting it out there, asking people in the room if you are comfortable with it. And I hope that everybody in the room are going to be rolling up their sleeves at that time and just getting it. That's my short blurb.
Dr. Hi, it's Heidi, and thank you for offering that. I have to say that I've spoken to members who are very concerned about getting the vaccine. And so I would like to put out information through my network, and I know I reach 60,000 people when I send out one message. Not promoting it one way or another, but encouraging people to get educated on, if there are risks, what they should be concerned about. Certainly the questions and the concerns that were brought to my attention, I have no authority in giving any kind of guidance on it whatsoever, but it would be really helpful to reach people and, kind of cut this at the pass so that they can put it within their power to get information and seek the, the advice that they need.
Okay. So we got on the meeting at 4 o'clock. Probably at about 3:10 or something of the sort. I was speaking to a family who I know very well, and they just buried family member on Saturday, and basically the story is that this person had a cardiac issue, went into the hospital and came out, and somewhere in that process of navigating the healthcare system and going into get testing done, going into the pharmacies, etc., to get pick up medications on the way home, someplace in there, they got COVID.
Yeah.
Had to go back in, didn't make it out. And this family's saying maybe if it was 2 months later and they had the vaccine. So even as we just look at the 300,000 and you think of it as, oh, it's a number, it's a big number. If you just get it down to that one family where you look at them and they are just totally broken up.
Yeah.
We just need to do everything that we can possibly do.
Yeah. I don't know if there's something written that you can just maybe send to Emily. She can get it to me so I can make sure it gets out there. I would venture there's not a family in Ulster County that hasn't been affected somehow, some way, impacted with COVID and are dealing with it. So we need to do what we can to get people to take this vaccination.
I just want to make one point, not to belabor it, but I think what we're faced with, right, is a significant lack of trust, right?
Yeah.
I think everybody here knows that, right? So like, how do you regain trust? And I think that one of the things that we tend to do, and because of social media and everything else, like we kind of get on a soapbox and we get people who are going to be on our soapbox with us and we feel stronger. I think there really needs to be a significant movement towards empathy and compassion for the people who are afraid of the vaccine, and try to really feel that with them and understand how to try to get them to understand, to potentially think differently. Driving this down people's throats in this environment that we're in right now is not going to get more people to step to the plate. And it's bizarre, right? Because this is a life or death issue, but the psyche, right, in our country right now, and the mistrust is so significant. So, leading with empathy and compassion might be a way to potentially get at least a small percentage more to jump on the bandwagon and roll up their sleeves. Just a thought.
Yeah, absolutely. And I put in the chat box some communications from our county executive that mimics what Dr. Woodley was talking about, where we are forming an executive sort of led team of community partners who want to be helping in communication messages so that we can all speak very clearly and carefully, our circles of influence, and give them the most factual information about the vaccine. So if anybody wants to be a part of it, the email to join the coalition is in the chat box. And also you can share that from our social media pages.
And Stacy, do you know if there's going to be, I've heard about nationally, there's going to be a huge rollout of a marketing campaign for it in Ulster County. Do you know if that's going to be coming here, or is Ulster County going to be doing their own kind of marketing campaign? Do you know any of that?
We usually take the lead of the New York State Department of Health as our parent organization. So we would probably be in line with their communications, which come down from the CDC generally. Yeah. But there's possibility that the new coalition could develop some communications as well, and fact sheets that, will be made widely available to everybody.
Yes, I agree that the having the county do an ad thing and so on is great. But one of the best things is the personal touch, because very often, not even this measles vaccine, etc., where a parent would come in and say, I don't believe in it, etc., 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 and inevitably, one of the questions they ask you is, did you vaccinate your kids? Yes, I did. Sure. Flu shot. Did you get a flu shot? Yeah, I did. And that carries a lot more weight, I think, than just what comes out from the county. So that's why, getting back to us as a group, if we are on board with it, it's great to just say to people, I think you should get it. I'm going to get it. Or I have already gotten it. I think that carries a lot of weight, especially if those people trust your judgment and they are fairly certain that you were not going to jump into something that is crazy. That carries a lot of weight. So yes, the county is going to put out stuff and so on, but I'm encouraging each one of us to use our influence, because actually our influence has a lot of power to change people's hearts and minds.
Hey, can you guys hear me? Am I on mute?
No, we can hear you. You're just still broken up, but we can hear you. Oh, now you're on mute.
Yeah, you're muted. Okay. It's lagging a lot. Okay. Am I good? Good now? Okay. I was saying, Dr. Woodley, I'm not gonna lie, I am one of those people who are really nervous to get the vaccination. I'm not one of those people who get the flu shot either. I have all the standard, like MMR, I have the baseline, but something about COVID, maybe it's just because it seems like there was a lot of misinformation about COVID in the beginning, and it still doesn't feel like it's like very widely understood. It just makes me really reluctant to get the vaccine, and I'm not saying that I never will, but I definitely don't see myself as being one of those people who's lining up next week, just because I want to see. I don't know. I don't want to feel like a guinea pig or like a lab rat, and I kind of want to. I don't know. I know there's other people like me who feel that way, who feel, like Steve said, that sense of mistrust about, just in general, like a sense of mistrust. And yeah, so maybe you can provide some information.
Okay,
That would feel more sound.
Cliff notes. So in terms of mistrust, one of the biggest groups out there in terms of mistrust, and I don't want to be a lab rat, is the African American group, because there's history of that out there. But the thing about this is the big question that people ask is, how is it that it was done so quickly? Well, you see, the reason why is because this was not started from scratch. there are other coronaviruses that have been out there, like SARS and so on. When those came out, people started looking at the virus and looking at vehicles that could be used in a vaccine. So there have been people in the background working on this for the past 10 years. SARS was about 10 years, yeah, maybe 10 years. And what happens is now that this kind of similar type of virus is here, all that they've done is they've used the sort of base information, the base transport system that they have already looked at, developed, and so on, and say, now, what are the specifics about this one that we could take and put onto that base that we have and use that as a vaccine? So, in your mind, it's kind of like building something with Lego blocks. So once you have certain pieces, you could use a set of blocks for the chassis and the wheels and so on that you've already had. That's there. And then you just have to figure out the other pieces to put onto it to build the little Lego car, the engine, and so on and so on. You're not starting from scratch. And that is the big difference with this one. So that is difference is, one, they weren't starting from scratch. Two, one of the big drawbacks with being able to get anything out really quickly is funding. In this case, that was not an issue. There has been unlimited funding. So you could get as many scientists as you can, as many of the best brains to just go in and work on this. Funding isn't an issue. That's two. Number three is, usually you have one lab working on something or two labs, because they always have to look at, the bottom line. When I invest X in this, what am I going to get out of it on the other end? So because in the case of SARS, the reason why there wasn't a SARS vaccine was because the outbreak was so limited that it wasn't really worth it to go and dump billions of dollars into a vaccine that people are going to say, why am I taking this? So when you have scientists all around the world, China, Great Britain, Europe, Japan, India, US, all around the world working on the same thing, you get a synergistic effect that things could move a lot more quickly than if it was just one or two. In terms of safety, across the board, this has been vetted by different groups outside of the US, and they have absolutely no interest in whatever conspiracies there are in the States. And the answers that all of these groups have come up with are consistent. So I think that this, even though it was very rapid, might actually end up being one of the cleanest vaccines that's come out recently. The only thing about the vaccine is that the storage is not easy, it's cumbersome, and it's going to be so, not if we are going to get it, but how much are we going to be able to get and store at a time to be able to get it out quickly. If it was something that you could just throw into any old freezer, like the Moderna one is gonna be, that's a lot easier, because then you could just put it out there, any practice, any hospital. But with the super freezers that are out there on order and are on back order, that's a little bit of a concern. But the vaccine itself, not a concern. If they brought it to me now, I will roll up my sleeves and take it.
Stacy put some information in the chat. Stacy, do you want to mention what you put in there?
Okay, so I'm unmuted now. So I want to just say that our focus is on listening to your questions, and it's normal to have a lot of questions. So we want, as public health, to find the best and most accurate information.
Absolutely.
So that is some of the purpose of this coalition moving forward, and that will be formed. So if any of you want to be a part of it, we would love for you to join up. And I will put in the chat box the CDC's vaccine information, because that is a trustworthy source of information. And as far as what I'm learning, this vaccine has passed all the tests with flying colors. I was on the New York State call this morning about it, and I'm really impressed and feel very comforted by what I'm learning, and do plan to be vaccinated as soon as I can be, and have my family vaccinated. Unfortunately, it's not for children under 16 yet, but we will be so happy to get what we can right now when it's available to us, because it's really going to create just a lot more freedom of ease of mind than the risks of contracting COVID. So, I would totally be on board with it. And, if you have questions, let me know, and I can bring them to Dr. Smith and get back to you with the answers.
One of the questions that people have been asking is, realistically, how long before it gets to the general population? Because, there's a whole list, and I'm not arguing with the list, but there's a list of people who need to be vaccinated well ahead. And I might fall in a category. I'm 66 years old, so I might, move up to the head of the line. But realistically, how long is it going to be? Because even with people vaccinated, the vast majority won't be vaccinated within 4 months, 6 months, 9 months? What's the timeline? That's what people are asking.
Okay,
yeah.
so
No.
Okay, go ahead.
Well, I haven't gotten a very clear answer on that, Dr. Woodley, so you can chime in, but I did take down the note, and I will bring it to Dr. Smith and get back to you.
So in broad strokes, there are a set of tiers, 4 or 5 tiers, and so the first group is hospital workers, and then the last group is going to be general public that in quotation marks healthy. So, but the thought is that if supply is there, all groups could receive their first dose by 3 months out. So let's March, April. But then remember that it is a 2-dose process. So all groups will have to get a second dose after, and the second dose is a month after, approximately. So the thought is that at least by spring, everyone should have at least their first dose in them. The conversion rate on the first dose is 56%, something of the sort, and with the second dose it goes up to 95. So it's not it's not that the first dose does nothing, but it's no way as effective as having both doses in.
Thank you, Dr. Woodley. I've been reading the information, so what you're saying supports a lot of the stuff that I have been reading, and not on Facebook. I'm actually reading sort of scientific stuff, half of which I don't understand. But again, the unknown is if we have the supply. And so currently in the United States, I know the United States is trying to get more of a supply into the pipeline, but what you said is sort of a best case scenario if we have the supply. What's the worst case scenario if the supply chain breaks down or whatever?
I really don't know where to go on a worst case, because now we are looking at it, knowing that okay, we have 2 vaccines that are out there and that are good. However, there are about another 6 or 8 vaccines that are out there in the pipeline, in the process, and the expectation is that some of those are going to come on board also. So it's kind of hard to judge that, really, and I won't even stab at it.
Thank you. That's fair.
I wanted to possibly save a little bit of time for our executive session. So can I send out to everyone some information, maybe through Stacy, and I'll make sure that I share it with everybody to share out to your networks. And I heard Stacy say that if anyone has any questions, that she can get them answered and get back to you. And I'll connect you with Stacy's contact as well.
Thank you.
This is Jerry. If I can just say one very short thing. There are vaccines now in the Hudson Valley. I was in Mid-Hudson Regional Hospital yesterday in Poughkeepsie when they gave the first vaccinations to frontline workers, and they have a decent amount. I don't know what the number is, but they are giving them out under the tiers that Dr. Woodley spoke about. He was talking also earlier about sort of bringing it down to the individual. And one of the fourth person who got the vaccine was a doctor, and I was looking at her, and she looked very sort of pained, and her eyes were sort of misty, watery. And I said, "It's going to be okay." And she said, "I know it's going to be okay. It's just that my mother died of COVID just a few weeks ago."
Oh.
And she was so moved, I guess, about, or the sort of the juxtaposition of what happened to her mother and what's happening to her now really, really moved her. So anyway, I just wanted to say that.
Thank you.
Thanks for that discussion, everyone. It's clearly top of mind, and it's all stuff that we're all thinking about right now. And Stacy put in the chat that they know that people have questions, and there's another link to another website. All right, so I want to say goodbye to our guests, Heidi and Steve and Siobhan. Thank you so much for joining us. I hope that you consider joining us permanently, semi-permanently, and I want to say goodnight to you now.
Thank you all. Take care.
Good night, everybody.
care.
Good night. Thank you so much. Stay safe, everybody, and wear a mask.
You too. Thanks. Bye.
And I'm also going to stop the recording now.